I work for Mohammed bin Rashid University of Medicine and Health Sciences. I'm a senior specialist at the Strategy and Institutional Excellence Department within MBRU. MBRU is part of Dubai Health. We use Blue on both levels, on the level of MBRU and on the level of Dubai Health. My role, so I work in the department which is the equivalent to the quality assurance unit, which is a requirement for any higher education institution. We also handle the strategy portfolio, so it's a combination of strategy and quality assurance. We were struggling, one, with the amount of work that needs to be done in order to assemble surveys, to invite the students to respond, to create different reports to different stakeholders, etc. And then we started looking for a solution that would automate the process and also facilitate the engagement with the different stakeholders and to get their buy-in as well. We looked into several options actually. Blue stood out for many reasons, but primarily the reputation. So we did connect with a lot of stakeholders and they gave us very positive feedback about their personal experience, personal, professional experience with Blue. The software, of course, but also the team, the community.
What changes have you seen within MBRU since you started using Blue?
The ease of doing the tasks that I used to do before. So it's way more efficient and also effective. So in terms of the amount of steps that I needed to go through and the amount of time and resources that I needed to invest to actually collect the data, analyze the data, report on the data, customize the reports, oversee the response rate. So in a sense, it saved resources, which is why it made things more efficient. And it also minimized errors and helped in maintaining the confidentiality and the privacy of the participants, the students. But we use it to capture the perspective of the students, but also the perspective of the employees, the staff, faculty, and other stakeholders as well. It has been very important for us. It helped us in terms of documenting the feedback. Engaging the stakeholders, and then also using this data to actually contribute to knowledge, whether it's the quantitative or the qualitative data. I'm also working on empowering particular stakeholders to be able to maximize the utilization of data. So we're investing a lot of time now and resources in closing the loop within the institution and to promote evidence-based decision making. So we're making sure that the data is going down to like every instructor, every course coordinator, every director, program lead, etc. And then we're engaging them in reflection meetings for them to really learn how to, number one, to create the space to reflect on the data, but also to learn how to act, how to take the data seriously and how to act upon it. And then to actually articulate data-driven action points, put them as part of monitoring and evaluation frameworks, and to monitor action over time. And then we created a campaign which we're calling Your Voice is Heard. And we're making sure that any action point that is closed, we communicate back to the students and to the rest of the stakeholders. So we are putting a lot of effort, and all of this will feed into the continuous quality enhancement function.